So my interests are both clinical and translational in nature. I'm a pathologist who has specific interests in pancreatic cancer. Pancreatic cancer is a disease that basically is most often diagnosed late at a point when patients are no longer surgical candidates. And so what we're particularly interested in is finding and diagnosing pancreatic cancer sooner. Through easily performed laboratory tests. And so as a pathologist in particular who's involved in laboratory medicine, I'm extremely interested in developing assays and techniques that would allow us to detect pancreatic cancer sooner and potentially get patients to surgery and dramatically affect survival for the disease. Canary obviously has a clear focus and direction in the types of tests and assays that need to be performed. I think for any type of cancer, with a clear focus on early detection and developing assays and tests that in a sort of entrepreneurial way will immediately be taken to the clinic and dramatically affect patient care in a very rapid way. So I'm actually really functioning as a facilitator at this moment. As a pathologist, I have access to lots of tissue specimens and materials that are important on the front end and on the back end of the process. So on the front end of the process, important for discovery tools, for finding new markers that we might exploit for early diagnosis. And on the back end, actually, once these tools are developed, to go back and validate them in tissues before we get into the nitty-gritty of looking at larger numbers of patients and specimens and making sure we're actually pursuing the best types of tests and biomarkers.